Hi everybody, my name is Summer Lopez. I am a physiotherapist here in Kingston, Jamaica, and this is video number 2 for our back education and training. So video number 1 was the very most basic. This is a little bit more involved, so I hope you enjoy, and let's get started. So we're going to start with the stretches. So we want to stretch all the muscles that attach into the pelvis. So we're going to start with hamstrings. We did use a strap or a belt or a towel last time. So we want to just make it a little bit more intense by pulling your toes down towards your shin. Go ahead and make sure your spine is lovely and long, head is supported. So I'm not going to hold my stretches for 30 seconds just so that we can not be here for too long. But when you're at home, definitely once you learn the routine, hold them for at least 30 seconds. And remember to stick with it, because soft tissue change takes a long time. Weeks and months, not a quick fix. So this is a lovely hamstring stretch. All right. So we're now going to move to the adductors, which are these inner thigh muscles. So keeping your spine in neutral, grab your inner thighs, kind of help to wrap them that way, externally rotate them, and reach open. So that doesn't look like a big stretch, but it sure feels like a big stretch. Make sure your tailbone didn't lift or your back didn't arch. So again, neutral spine. Good, you can bend and open. So you're using your hands to kind of wrap the thighs around. Right, and we really want to free up the muscles that attach to the pelvis, because if they are short and tight and they affect the tilt of the pelvis, that could really have a negative impact on your spine. All right, so now we're going to stretch abductors, outer thighs. So from a quadruped or hands and knees position, we're going to take one leg under, extend the other leg out, just ease it out nice and slow, elbows under, shoulders, and again, make sure your spine is not all rounded, and get nice and long. Relax. So you should feel that hair. Our patients call that their back pocket, right? So just taking some nice big slow breaths there. Good. So that's usually pretty relieving for patients with low back pain. Okay, so from that, again, hands and knees position, we can just bring the other leg through and do the other side. Okay, so elbows under shoulders, a nice long spine. So now you should feel it in that back pocket. So it's some nice big slow breaths. Okie dokie. So coming up, I want to talk a little bit about the shoulders. So a lot of us have, if we spend a lot of time on the computer or driving, a forward head, forward shoulders. So it's really hard to get a proper position and alignment through the spine if that's happening. So in this position, we want to just feel the bad spot, internal rotation and the hike of the shoulders, and then we want to really feel the good, right? Kinesthetic awareness. So we can do what we're not supposed to do, and then do what you are supposed to do. Lengthen the back of your neck, draw the shoulders down. All right, so one more time, what you're not supposed to do, and then what you are supposed to do. All right, and then we did this in phase 1 too, but it's that important that we'll repeat it again. So if you have the circle of your ribs, and you've got the circle of your pelvis, and you've got the circle of your shoulder girdle, you want those 3 circles to be vertical, all right? So you want to pull the ribs in, sacrum forward. At work in the clinic, we call this grilled cheese type feeling, right? And again, I feel that really nice opening through that hip. And for some patients who don't have great balance, this will be a challenge for balance as well. So please don't do it up on a table, please do it on the floor. All right, so let's switch sides. Okay, you've got the sphere of the shoulder girdle, the ribs, pelvis. You want to stack those all up. Get your grilled cheese happening, and just stay and breathe. Get nice and long. You know, practice dropping the shoulders down. So remember guys, for low back training, repetition rules. Practice makes perfect. All right, so that was just the stretching. We're now going to go into the bracing part of it. So in the first video, we taught ourselves how to like be in the right position and activate transverse abdominals. So now we know what to do. We're going to get up to 90 degrees. Give ourselves a little resistance there. Exhaling. And back it off. Another time. A little resistance. Nice. We can do a crisscross applesauce. So, I don't know if you can see it, but I'm shaking a little bit. Good. So once they're all fired up, we can put our fingers here. We can go into an alternative march. So we want to be able to do this without any movement through the pelvis or the spine. So a nice exhale. It's really helpful. Put your fingertips under here to kind of monitor, to make sure you're not having your back move up and down as you go. So that's an alternate march. Great. All right. So next, we can go into side lying. Again, have that imaginary broomstick or wall behind you, head, rib cage, pelvis all in a line. And extend the top leg out. Hips are stacked, shoulders are stacked. We can lift the leg up and down. Maybe repeat this for a minute. We can take the leg bent to 90, kick it forward and back. And the reason we bend it is to take the hamstrings out of the equation, okay? So if my leg was straight, the hamstring would pull and I'd have a harder time keeping my pelvis still. So that's why we bend it. All right, I can put a pillow here, okay, and I can do some stuff with my bottom leg. So we're trying to move the legs without moving the spine, without moving the pelvis. Same idea, bend it. I can take it forward and back. Ideally, it's nicer to have a foam roller here, but again, I'm at home. I'm not in the clinic. All right, and then we can just repeat that on the other side, which I won't do, but just make sure you run through all of those exercises on the other side as well. So next, we have what we call the lumbar protective mechanism, strength while we move. So we're going to bridge. So we definitely don't want anything under your head when you bridge, because that will compress your neck. So in the first video, we did bridging like this. Now, we want to challenge it. So we can march, making sure there's no motion at the pelvis. All right, tons of variations here. So hopefully I'm doing a good job of keeping my pelvis still. I can hold it up, I can do small circles, reverse the direction, bring it back down. So at our clinic we also teach Pilates. So a lot of these have some Pilates inspired aspects. Good. So that's bridging, single leg bridging for added difficulty. All right. Okay, active sitting. I'm just going to get a chair. I'll bring it right into the frame. All right, so in the first video, I'll turn to the side. We talked about getting our weight forward. Oh, this is where I'm going to use my nice cup full of lemon water. We talked about having your thigh 50% off. All right, and we did weight shifts. So now I want to be able to kind of move. I'm not at the clinic, so I don't have any fancy weights or anything. You could use a can of beans, water. You know, you want to be able to kind of keep the shape of the spine as you move the arms. All right, so this can be anywhere between 3, 5, 7 pounds. All right, so that's active sitting. And then we have some quarterback squats. So we are a football soccer nation here in Jamaica, but these are called quarterback squats. So I'll stand here Nice wide stance, turned out, neutral spine. I'm gonna get my elbows on my thighs. So I'm trying to create the shape of my spine as if I were laying on the mat here. And then I wanna disassociate, right? So I'm moving my legs, but I'm not moving my spine. I don't have the mobility in my hips to get all the way straight to straight knees. If I did, my spine would change shape, and that's not what we're going for. All right. So again, the idea would be to do those for about a minute or so to just get those back muscles working. Great. So I hope that was helpful. Share with your friends, and you can find us at BodyForte Physiotherapy and Pilates in Kingston, Jamaica. See you soon with video number 3.